Thank you, Deputy Presiding Officer. Minister, I have operated on many of these cerebral palsy patients, and I'm thankful to Sarah for raising this. Although the cerebral palsy is not a terminal condition, it is a chronic condition, with over 6,000 people living with it in Wales. Cerebral palsy Cymru supports children across Wales with their critical early intervention service, Better Start, Better Future, which maximizes the opportunity to establish neurological connections that are only possible up to first 2 years of life. So early specialist intervention can make difference between a child learning to walk and talk, for example. Unfortunately, due to rising costs, their internationally acclaimed service is at risk. They are calling upon Welsh Government to help protect their expert service for next 3 years, giving them the time to further develop new forms of sustainable funding. They are asking...
You need to ask a question, please, Altaf.
Yeah, so I will ask that, sir. Their ask is just 0.005% of the current annual health and social care budget. Minister, we are talking about a relatively tiny amount of funding, but the outcome it delivers are immeasurable. Will you support that funding support or request?
Well, thanks very much. And it was made very clear to me on my visit that early intervention is really, really key when it comes to being able to try and do something about the most adverse impacts of cerebral palsy. So thank you for reminding me of that. And you're quite right, if you can intervene, then we should, if we've got the ability to do so. It is an expert service. What I can tell you is that actually where the money goes within the Health Board has got to be a clinical decision for the Health Board itself. I cannot intervene as the Health Minister and determine where exactly within all of the calls that they have on their demands for healthcare, where specifically that goes. Because it may be, you know, that in other areas, it may be that we don't have the experts, or we do have the experts in certain areas. We have to think about what is best for the patients, but I have to take the lead from the Health Board in that.